Hi, welcome to Talk About here on ShawTV North Island. My name is John Twigg. Thanks for tuning in. The guest today is Lois Jarvis. I'm tempted to say everybody knows you, but just in case, she's here with Citizens for Quality Healthcare and a few other things we'll talk about too. But thanks, Lois, for coming in.
Thank you very much for inviting me today.
You seem pretty busy. I see you at a lot of things, but your main focus, is that Citizens for Quality Healthcare now?
Yes, pretty much, and also our Heart Society.
Yeah, the first Open Heart Society,
Yeah,
Campbell River branch.
Mm-hmm.
Okay, well, we'll perhaps get to that, but you were in City Council this week as we're recording, and Council passed a bylaw, but it has to go to a public hearing first, to regulate pay parking at the new Campbell River Hospital. Tell us about that. What's going on there?
Well, it's pretty exciting, really, and I have to really thank our mayor and council. I think we really appreciate them standing up for all the citizens for this. It's been going on for a while now. We wanted to see free access for everyone to our hospitals.
No pay parking.
No pay parking, and you know, we just have a real problem with a private parking company making a lot of profit off of the sick and most vulnerable people in our society. So anyway, council has, in December, Councillor Sampson brought up a motion for staff to prepare a bylaw, and that was unanimously passed. So the bylaw was presented the other day at the council meeting on Monday, and they voted on the unanimously again to pass first and second reading. So then it has to go to a public hearing on which is February the 6th at 6:30 at council, and people can phone to get on the speaker's list to speak to the proposed bylaw, or they can actually send in a letter to the mayor and council if they don't want to speak publicly. After the public hearing, 2 weeks later, on February the 20th, they will be considering the third reading. So if that passes, it's a done deal.
I'll go back to this a bit, but when does the hospital open? Because it's getting close, I think.
It'll be finished about April, and then there is a 6-month transition period.
Okay.
So for moving in, training staff and everything. So it'll be the fall of this year that it will be open. So,
I mean, it is timely, but it's not super urgent.
We'd like to see it move a little faster, but I understand also that Courtney is watching very closely, and they plan to follow suit.
Yeah. Now, there's a pretty good write-up of this issue in the Mirror by Kristen Douglas, and refer you to that. You can get it online as well. But I gather VHA, Vancouver Island Health Authority, is not happy about this idea.
Well, they probably are not. They say that they want pay parking at both hospitals, and they said that they want $1 million to maintain 2 parking lots. So we did a little research on that, and in the financial pages for Island Health, they get $7.5 million a year from 11 health facilities who have pay parking. So 11 raises $7.5 million, and they say they want $1 million between these 2 hospitals. They refuse to answer as to how they came to that figure.
Nice round figure.
Yes, and they refuse to answer how much the private parking company would get.
Yeah.
And they have implied that if we don't pay the money, that we would, they will have to take money out of
services.
Services.
Yeah. That's in Kristen's story too.
Yeah.
The excuse is that, oh, we want to give all the money we get to services.
Well, that is very interesting too, because we heard those kinds of things when we were initially fighting to get our hospital. They were going to reduce our hospital here to a triage facility, and we were to have one hospital down south. A lot of us joined together, including all our doctors, and we worked very hard until the decision was changed to get 2 hospitals, which every previous study said we needed.
Imagine
for the
size
of the area.
Hospital in a town of, well, I'll say 40,000, be counting the surrounding, and then it's the regional hospital from the whole North Island.
Yeah, it's actually 55,000 people that it serves, and but we heard those things like, you know, if you make waves, they could give the money elsewhere because all the other hospitals need money. And if we had listened to that, we wouldn't be having this new hospital today.
No, the reason I wanted to have you on is because this story just angers me. It's you know, VHA is, you would think it is a service-oriented thing, but they've got politics happening too. And you know, we're an NDP riding, and anyway. Thank goodness there's people like you and many others who fought to save our hospital, and now we're fighting to save access to it. We just don't think it's right. They say that they need the money, and we did look at, we said, well, you know, there is another alternative. If everybody paid a little more on their hospital tax, perhaps we could do it that way, but a lot of people didn't like that idea. The North Island mayors didn't like that idea because they feel once there's a tax imposed, it escalates, but so does pay parking. So that didn't fly too well. So I'm really proud of our mayor and council for standing up to this. And I think when we see the amount of money right now that is being handed out before the election on May the 9th, and 15 million apparently just for the ad about their affordable housing proposal. So the government can find the money, but
there's millions being. Our money is going on TV and radio ads right now at our expense.
I want to focus on the parking a bit. If time permits, we'll get into some more politics. But you know, Greater Victoria has 2 major hospitals. There's one in the urban area in Victoria near Oak Bay, and there's lots of street parking around it. And there's, of course, I think it's pay parking there.
Yes.
Now, they have another one out on the highway towards Goldstream, and it's in the middle of nowhere, surrounded by a big parking lot. That's pay parking. And, you know, I guess you could make an argument that it should be free out there because there's no other choice. The downtown one, maybe, you know, okay, you want to get a spot close to the door for some reason, okay, maybe you pay. But here in the North Island, you know, we're servicing people that have driven down all day from Port Hardy and for perhaps a 2-hour wait to see somebody to do something. And, you know, that's such an impediment to healthcare that at some point people will say, oh, I can't afford the parking, and they'll get sick, and then the bill goes up. It's what I call a false economy.
We certainly brought that up. We are in a different, unique situation for the North Island. We're in the largest geographical area for Vancouver Island. And what's happened to all our resource industries? They've all crashed.
Except, well, forestry is still going, but we're worried about that.
Yeah, and so the wages that people are getting now in the North Island are not lucrative like they used to be. And so this is an extra burden. And my mother-in-law spent 8 years in Sunshine Lodge in the hospital. My father-in-law went up every day and spent 8 hours a day with her. There is absolutely no way that he could have afforded to pay for parking.
Yeah.
And if pay parking is imposed, they have said, Island Health has said they will charge Yucauta Lodge for parking.
Yeah.
There will have to be signs put up all around the neighborhood so people can't park there. That will be at our expense, and the enforcement of that will be at our expense. So the implementation of it is all very expensive too.
Yeah. Now, Kristen's story mentioned towards the bottom that there's a hardship provision, and VHA says that, oh, for hardship cases, we'll waive the parking. I don't know how they'd manage that.
Well,
But that,
they have to go through a demeaning process with a social worker to be deemed whether you are really a hardship or not. Now, there's a lot of people that have pride and they don't want to be put through a demeaning process like that.
Yeah. No, it's frustrating. Now, about the hospital in general, the design of it and the construction. I think the construction's gone fairly well. I haven't heard any bad stuff. What's your take on how it's coming together?
I think it's fantastic. I'm on the Public Patient Advisory Committee for the hospital, and we're given a tour, and I am just very, very impressed.
It's a good design?
Yes, it's very good, and I can't think of a single thing that they have not thought of.
Well, actually, I can. Child care center. They left the child care center out. I had the health officer for the North Island on here. She presented to council a few weeks before she was on, Charmaine Inns. And they asked her what was the most important thing we could do for the health of North Island. And she said child care. And it's good for the economy, it's good for health outcomes, and so much like that. Well, tell it to VHA, because they didn't design a child care facility in there.
No, and it is 95 beds, and everybody wishes it was more because...
It's only 95 beds?
Yes, they... when they did the amount of work on trying to project what the populations were going to be like, the mill had just closed.
Oh.
And now we've got a lot of people coming into Campbell River, and we have Berwick with people coming from all over the place to live at Berwick to be near their kids. Yeah. We were there one day, and there were 6 people from Berwick in the hospital that day. So
we got retirees from Alberta moving here.
So we didn't really have the resources because there are a lot of elderly people coming.
Is the new hospital expandable? Is there did they leave room for a new wing?
Yeah, the design is there so that it's a module design where they could add to, but the problem is that when you look at the state of a lot of other hospitals in BC, it's going to be a very long time before we get funding for to
What's
add
the
to
present hospital size? How many beds in the old one?
Well, it's 75 now, but it was more than that when it opened.
Yeah.
And it's been over census every day for a long time.
Yeah. Over census meaning more people than beds?
Yes,
So
more than the 75
that means stretchers in the hallways.
Yes, and apparently right now they are really packed. The staff are stretched. They have people there because of flu and colds and a lot of falls.
Yeah.
And I wonder if some of those elderly people have fallen trying to get their mail from the community mailboxes in the ice and snow.
Now, 2 North, that's the elderly wing.
Yeah.
How is it going to transfer over?
Second North will no longer exist, happily. It is one of the most depressing places I've ever seen. It is a floor to have elderly people who are no longer able to look after themselves, but they have nowhere to go because there's not enough facilities for seniors. We are getting the new 40-bed facility that is attached to New Horizons, and that will ease some of the pressure. but there's still a long wait list. So when we have elderly people coming into our new hospital, at least they will be in very nice rooms.
Yeah, okay. Well, the city bylaw that's coming, I gather that's giving themselves the power to regulate parking all over the city. And so therefore they'll spot zone the hospital as a no-pay parking area. Is that the gist?
Yeah, and any other medical facilities and public places like public parks.
Right. So, and it's city discretion.
Tassus has a similar bylaw, and the mayor just sent it to me this morning.
Oh, good.
And Delta has the bylaw. Parksville has the same bylaw.
Yeah. Now, the gist of the story in the Mirror is that, well, if somebody sued, it would cost the city $20,000 to defend the bylaw. Who's going to sue? Who would sue?
There could be a challenge by the province, and they, I guess, can look into that, and they won't like the idea any more than they did when Delta put theirs in, but when they can come up with all this money, millions and millions of dollars, we have never had pay parking here, so this is new money.
Yeah.
And
it just occurred to me the Premier's stipend from the Liberal Party that she's only now getting as an expense allowance.
Yeah.
Maybe we could use that.
Yes, we could. And we could use the 15 million that they're using on the TV and radio ads.
Yeah. The Premier came to town as we're recording this. I got 1 hour notice that she was going to be here. And I didn't check my email, so sorry, Christy, I missed you. Would have liked to ask a few questions, not necessarily on what she was here for. Now, the old hospital, it's been a political football for a while. A couple of mayors have said they're not going to issue a demolition permit on it, which apparently is a city power only the city has. What's your read on what are we going to do with the old hospital? What would you like to see?
Well, what I would like to see is the newest part of the old hospital, which is not very old, kept, because I see VHA offices rented all over Campbell River. We don't have a palliative care place. We don't have rooms for the mentally ill. And I think there's a lot of uses they could do, but they're adamant, and it's part of the P3 contract, that they are taking it down. And I guess maybe because it doesn't fit into the P3 contract, I don't know. But council even asked at one point if they could actually purchase it. And that was vetoed. So
maybe we can make it an issue in the election campaign.
It's going to come down. It's part of the contract, and it's been brought up many times at the meetings that they've had.
I know it's flawed. It's got asbestos, and it's not very good for earthquake. But you know, you look at the healthcare around the world, and the existing old hospital in Campbell River is better than 99% of them.
I know.
So, you know, and like, you know, you mentioned a few things it could be used for. I would add social housing and addiction treatment.
Addiction treatment, definitely.
Yeah. So, oh my, it's, you know, it's frustrating doing these kinds of shows, and it's frustrating being a journalist because there's so many travesties that, you know, we seem powerless to fight. Health and provincial politics in the coming election. Do you think it'll be a top issue or a middle issue?
I think it's going to be really a top issue. Our health care is very important to us, and our public health care system has been starved for years. And at the same time, the provincial and federal governments are not upholding the Canada Health Act.
I was going to get there, the federal-provincial relations, and there's stuff now, just in the last few days, actually, there was some of the premiers are signing side deals. What a mess. Yeah,
during the Prime Minister's campaign, he promised a new Canada Health Accord.
Yeah.
And that seems to be going by the wayside because they're dividing and conquering with the provinces. The current federal government is proceeding with the huge cuts in transfer payments to the provinces from 6% to 3%, which is half.
That's the increase per year.
Yeah, and so they have said they are continuing with those cuts, and if the individual provinces negotiate with them, they will get money for mental health and home care and that kind of thing. Yeah. So they already have, Saskatchewan has signed a deal with the federal government, and 3 of the Atlantic provinces and 3 of the territories. So they're fracturing little bits. So we won't be able to get a Canada Health Accord with this happening, and so Manitoba is fighting it.
We're going to get a Canada Health patchwork quilt effect.
Yeah, and Manitoba's fighting it. Good for them. They're putting ads in the paper, and they're saying the amount of money that is being cut could provide so many hip surgeries and so many different kinds of MRIs, different things.
Yeah. Obamacare. The United States is going through a similar process right now. President Trump is promising to get rid of Obamacare, which he argues is dysfunctional, and I think from what I've seen, he's correct. And he's promising to replace it with something we don't know yet. And it's very, I guess, tendentious is a good word for it. What's your take on what's going there?
Well, I think the intent was that President Obama wanted everyone to have, in America, to have access to health care. Yeah. And the House was Republican, and they shackled a lot of his ideas, so it was watered down quite a lot from what it was supposed to be. And President Trump is now going to repeal all that, and nobody knows what's going to come out. But I did see, and I mentioned it to you, a comment from an American on Facebook that said, other countries are not going to understand what's happening here because we encourage everyone to have guns, but we won't let people have health care.
Yeah, right. Okay, well, I'd love to do an hour on Trumpism, but we won't. Now, you used to be in the co-op, the Federated Co-op Campbell River Division, is that what you correct?
I was on the board for the co-op.
You were president for 14 years?
13.
13, oh, pardon me.
Yeah, I was, at one point it was going to close, and we liked the store, and
this was the grocery store.
The grocery store and the gas bar and the whole thing, and so at the meeting where they were about to close it, we decided to keep it open, and I was voted or put on the board. And we had other people that were willing to step forward and be on the board, and we kept the store going for a long time, but once Thrifty's opened, that kind of finished it off.
Actually, some of the staff went to Thrifty's, I think.
Well, yeah, the manager, and I actually spoke to Jim Steele, the manager of Thrifty's, and we said we have really fine staff and they're well trained, and so he did take quite a few of them.
But the co-op still exists as a gas bar.
Yep.
Yeah, and I see they had an annual meeting, and seems to be doing fine.
Yes, the gas bar is doing fine.
Yeah, okay. Are there other issues you'd like to talk about? I got a list of about 5. Well, we don't have more than a few minutes, but is there something you want to add?
Well, I think it's nice that you have this show to bring these things to light with people, and I do hope that people will support the public hearing for the hospital. Some people, for the pay parking, to ban that. Some people do think that if we don't give Island Health the money, that we're going to lose services, and that is not true. That is not going to happen. There's many avenues that the government has to get funding. I just found out one the other day that our prescriptions are now changed. The coverage on a lot of prescriptions have just been changed. So we're going to be paying more for prescriptions, and of course we're paying more for MSP. So, and I found out something too. A friend was waiting for an MRI, and she found out that she could actually go to where the mobile MRI was and circumvent a long wait list by doing so.
Huh.
She could book an MRI in Port Alberni, where it was. So somebody took her there, she had the MRI, and now she's got back surgery scheduled in Victoria.
Huh, amazing.
Yes.
Yeah. I thought you might have mentioned the water quality issue and the waste dump, but in Campbell River here, that's the water, there's a, anyway, I've got to wrap it up, so we won't go there. Lois, thank you very much for coming on talking
Thank
about,
you for inviting me, John.
Okay. And Andrew, Sam, and Tiana, thanks. Tiana's directing today. I had it wrong last week, so anyway, thank you very much for watching Talk About. ShawTV North Island has a YouTube channel where you'll be able to watch this over and over and over if you wish, and the other shows too.